Right, hello everybody and welcome to our webinar all about disabled students allowance and the assessment process. So my name is Tara Chataway and I'm the manager of our student support service at Thomas Pocklington Trust, and I'm really delighted to welcome Leslie Morris, who is the chair of the National Network of Assessment Centres, so NNAC, who's an experienced assessor herself and had a lot of experience of working with students with vision impairment. She used to work for Royal National Institute of Blind People as well. So we're really delighted to have her here today. So how this webinar is going to work is we're going to start off with a presentation by Leslie, and we'll talk you through some of the important key things that you need to know around the assessment process. So what an assessment's for, what kind of equipment might you be looking for, what does non-medical help mean, how to prepare for your assessment, and what happens next, what happens after your assessment. So hopefully by the end of it, this whole assessment process will be demystified. After Leslie's presentation, there will be time for some questions. If you can ask your questions via your comment box, and if you can send them, direct them to Molly Hobbs, who is my colleague at the Student Support Service, and then she will ask those questions to Leslie. You can either have your questions as anonymous or you can use your name, whichever you feel comfortable with. If we don't get through all the questions, then Leslie has kindly agreed to answer the questions afterwards. So you'll have to bear with us because we'll have to go through that process of getting all those questions answered. This session is being recorded and it also will be available for you to watch on our website. So we will send everybody who participates in this webinar a link, and then we'll also be promoting it via our social media channels. We will be tweeting throughout the session today, so if you are on Twitter, please do follow us. And I think that's it for the main kind of process about how today's going to work. I really hope you get a lot out of it. Please ask questions as you go along. Don't have to wait until the question and answer session, and Molly will be monitoring those. So I'm going to now switch off my camera and hand over to Leslie to start her presentation.
Technology never works when you want it to. It was all working beautifully earlier, and of course it's not now. I'm getting messages up about people in the waiting room. I don't know if someone is letting them in.
Yes.
Welcome to this webinar regarding the disabled students' allowances. So first, a little bit about NNAC. We're the largest network of DSA needs assessment centres in England and Wales. We're the major providers of DSA needs assessments for Student Finance England and Student Finance Wales. And we also assess students from other funding bodies such as SAS, Student Finance Northern Ireland, NHS and Research Council students. And we have over 130 assessment and outreach centres in England and Wales. So what are the disabled students' allowances? They're grants to help meet extra disability-related costs associated with HE study. It's designed to level the playing field. It provides a significant increases in attainment and continuation rates, and it's recognised worldwide as a pinnacle of support for disabled students in studying in higher education. So who can apply? Well, UK students on eligible courses who have a disability or specific learning difficulty that has a substantial and long-term impact on day-to-day activity, and that includes study. This includes students with physical disabilities or mobility issues, sensory disabilities, specific learning difficulties, long-term medical or health conditions, and that can include things like RSI, ME or chronic fatigue, diabetes, epilepsy, HIV, Crohn's, cancer. A lot of people don't realise that these type of conditions can also be covered via the DSA. Autistic spectrum conditions and mental health conditions, and obviously students with a combination of those. So what funding is available? Well, the maximum amounts for this upcoming year for full-time SFE students are up to £5,849 for specialist equipment and assistive software, although there is a £200 student contribution, which I will cover later. Up to £23,258 per annum for non-medical helper support. Up to £1,954 per annum towards additional photocopying and printing costs and to cover the cost of the needs assessment. Funding towards additional disability-related travel costs. And there are different rates for other funding bodies and for part-time and postgraduate students, but I'm mainly concentrating on Student Finance England here. The above amounts are changing thanks to lobbying from, amongst others, the Thomas Pocklington Trust. It is going to change to a maximum amount per annum of £25,000, which we hope will provide greater flexibility, particularly for vision impaired students who often found that the equipment allowance was not sufficient. The general allowance, which is the funding for towards additional photocopying and printing costs, can be used to top up either of the other two allowances if there's insufficient money in the pot. But the non-medical helper support element can't be used to top up either of the other two. So this will enable greater flexibility. So what can the DSA fund? Well, it can fund the needs assessment fee, computer equipment and software, and that includes things like large monitors, printers, scanner copiers, refreshable braille displays, braille embossers, video magnifiers, electronic reading equipment, radio aids, digital recorders, and as I say, it includes insurance and warranty. It can also fund, in terms of the specialist software, things like mind mapping software, braille software, text-to-speech, speech-to-text, screen reading or screen magnification software, note-taking, spell and grammar checking, time management and organisation, presentation skills, and assistive technology training portals. And it can fund ergonomic aids such as keyboards or mice, equipment and furniture. So things like large prints, keyboards, for example, can also be funded via the DSA. The non-medical helper support includes specialist mentors for students with mental health conditions and autistic spectrum conditions, specialist study skills support for students with specific learning differences or autistic spectrum conditions, and specialist support professionals for visually impaired and hearing impaired students, mobility training and sighted guides, BSL interpreters and communication support workers, specialist note takers for VI and HI students, and specialist AT training, so assistive technology training, which can both be one-to-one and online training portals. It can also fund disability-related photocopying and printing costs, travel costs associated with travel either from your university accommodation to university or when in placement, or if you're staying at home, it can fund the additional disability-related travel costs associated with travelling from your home to the university. It can also fund additional accommodation costs where the accommodation is not provided by the university or its agent. So what can't be funded via the DSA? It won't fund costs that students would incur whether or not they were attending university, or costs that all students attending the course would also incur. So a student doing a fine art degree course, the DSA wouldn't fund the additional costs of buying art materials, for example, because Student Finance England would argue that all students attending the course would also incur those costs. It won't fund basic entry-level computers, tablets or Apple Macs, or high specification computers required for course-specific reasons. If there's a disability-related reason for funding a tablet or an Apple Mac, then Student Finance England will consider that. And typically Apple Macs with their better inbuilt accessibility features are really useful aids for vision impaired students. It won't fund the first £200 towards a computer because the government feel that every student should be expected to have a standard computer, a basic entry-level computer. So that's the amount that they've pegged on it. However, the DSA is still excellent value because of all the additional software and insurance and warranty and training that's covered. Students can upgrade the specification, but they need to do so at their own cost. What also can't be funded are costs that are seen as the institution's responsibility, such as adapted lab equipment, for example. If the university provides lab equipment for all students, then they're expected to fund adapted lab equipment where a student needs it. Transcription of materials in Braille or large print can't be funded via the DSA, however, it is seen as an institutional responsibility. And subject-specific software or course books, unless there's an exceptional basis. Universities are expected to provide students with the equipment, the software, and the materials that they need to study on their course. So it really does have to be on an exceptional basis. And it also won't fund subject-specific tuition or support. It won't fund counselling or other pastoral support, wheelchairs or mobility scooters, travel costs associated with attending medical appointments or when travelling to and from the university during the breaks, or support that exceeds the maximum amounts available via the DSA. As I said earlier, the flexibility that the new £25,000 will give should hopefully ensure that that is not so much of an issue. It won't fund accommodation costs where the accommodation is owned by the higher education provider or managed on their behalf. And for Student Finance England and NHS England students, standard note takers, practical, laboratory, library and exam support, proofreaders and transcription are no longer funded via the DSA. They're now viewed as the HEI's responsibility, but how they meet the students' needs is actually up to them. So if you feel that you need standard note takers, then you would need to discuss that with the university. So the application process. You need to apply for the DSA online at the same time as you apply for your student loan, or you can fill in a paper application form. Forms should also be available in large print or Braille. Apply early. The entire process can take up to 14 weeks, so it really is important to apply as soon as you can. The application process usually opens in the February or March prior to university starting in the September. So as soon as the application doors are open, do apply. You will need to provide disability-related evidence, which needs to state the name, the long-term nature and the impact of the disability. But there are interim arrangements due to COVID-19. So anything at all that you've got, send it off to SFE and they'll let you know if it's sufficient. The URL is on the slides, so you'll be able to access that later. So what happens next? You've applied. Student Finance England will then authorise a needs assessment, subject to them deciding that you are eligible. And this will provide a link to an assessment centre postcode search. The student then needs to arrange a DSA needs assessment. And it's just a case of looking at the postcode search. You can telephone them, you can email. Some assessment centres are attached to the university, so you might find that the university you're going to has an assessment centre and you might want to go there, or you may prefer to go somewhere nearer home. The needs assessments were previously usually face-to-face, but obviously because of COVID-19, they're currently via Microsoft Teams, Zoom, or other remote video method. You do have the option of waiting until things are back to some form of normal and wait to get a face-to-face assessment. You could also have an assessment, and then if you feel that your needs aren't being met, you could go back for an update. And you should know that the Student Finance England DSA letter plus the evidence, and that's the same evidence that you sent off to Student Finance England, will be required in advance of the assessment. Student Finance England don't automatically send that evidence to the assessment centre. So unless you send it to them, they won't have that. And you may need to complete a pre-assessment form, which is really useful to give the assessment centre a bit of information so that they can do some prep prior to your assessment and be prepared. So what actually happens at assessment? Well, it's an informal but in-depth student-centred discussion between the student and a trained, experienced needs assessor. All assessment centres have to be able to assess all disabilities. Not all assessors themselves can assess every disability, but you should be provided with a trained, experienced needs assessor who is aware of vision impairment and the impacts. A parent advocate or support worker can accompany the student, and the assessment will be carried out in a well-equipped, accessible assessment room. All assessment centres have to adhere to a minimum amount of equipment and software, so the assessment centre, once you get back to that, will be able to go down that route, and the assessments will take place where all the equipment and software is available. In terms of the online assessments, what many are doing is doing via screen sharing so that they can demonstrate the software if you're not already aware of what you feel you need. You should allow approximately 2 hours for the assessment, although sometimes it can take longer than that, sometimes it's not as long. So what should you do to prepare for assessment? Well, it's really useful if you consider the equipment and software that you're currently using or that you've previously used and how useful that has been to you. Also, any support that's previously been provided. So if you've been provided with note takers or one-to-one study skills support at school or college, any previous reasonable adjustments that have been made. So if you've had additional exam arrangements, if you've received materials in Braille or large print, or any other adaptations that school or college have done. And think about issues that you anticipate having on your university level course. If you have any additional evidence or information, such as has been provided through school or college, if you've got a letter from your support tutor, for example, you could forward that or take it with you to your assessments. And it can be useful to bring a list. You may not be able to get everything that's on that list, but it does at least mean it's a talking point for the assessor, and they can discuss with you what can and can't be recommended. So at assessment, the assessor should explore the impact of your vision impairments. So how that impacts on a day-to-day basis. They look at the requirements of the HE course and the likely impact of the disability on the study. So prior to your assessment, the assessor should have looked at the university web pages, looked at the requirements of the course, how it's delivered, how it's assessed, whether there's any placements or field trips or practical elements, lab work, etc., so that they're prepared. Once they know the impact of the vision impairment, they can then equate that to any issues that you're likely to have on the course. They will then demonstrate appropriate equipment and assistive software. You will hopefully be aware that there are loads and loads and loads of equipment out there, and as I say, there's a minimum list that we have to have, but assessment centres won't have everything, so they may be able to arrange a demonstration after the assessment in your home. There will be a discussion around the non-medical support or other DSA funding which can be recommended. Student input, it should be at the heart of the assessment. What about student choice? Well, this is taken into account, but you should be aware that the DSA is not a wish list. Everything that is recommended has to be extremely carefully justified, and it's got to be justified on disability-related grounds. If it's on course grounds rather than disability, then Student Finance England are likely not to approve the recommendations. We as assessors do have DSA guidelines and regulations to adhere to. It's not that we're being awkward. There are things that we know won't be funded via the DSA. We can discuss that with you, but we do have to adhere to the guidelines. There is an equipment matrix that we have to adhere to. One of the things that we hear from the Pocklington Trust is that students, visually impaired students particularly, don't feel that the equipment specification is high enough. The Department for Education has reviewed that. However, we are still stuck with the current system and specification that they have approved. We physically can't recommend a higher specification kit unless it is on absolute disability related grounds. So as previously mentioned, we may be able to recommend an Apple Mac, but there has to be a really robust recommendation and justification for that. And yeah, I've just covered that one. So what happens next? So you've had your assessment. So the assessor will produce a comprehensive needs assessment report, and you can request that either in draft or as final copy. And you can also request a copy in your preferred format. A copy will be sent to Student Finance England and, with your permission, to the Disability Advisor. You do have the option not to have the report sent to your Disability Advisor. However, you should be aware that it's a really good pointer to the university of the type of support that you're likely to require. The assessment report can't include recommendations for support that's considered the responsibility of the university or college, although we can highlight issues. So we can't say that you need a standard note taker or that your accommodation costs should be funded via the university. That is their responsibility. As I say, we can highlight the issues, but how they meet your needs is up to them. And you should be aware that SFE may challenge recommendations. They make the challenge to the assessment centre, and it's then up to us as assessors to either provide a better or a different or a more robust disability related recommendation. You should then get a copy of the letter from Student Finance England, which will indicate exactly what support they have approved. And the letter will include the contact details for the equipment and software providers and for you to be able to arrange your NMH support. The responsibility is on you to order the equipment and the software and arrange your NMH support. Students often assume that the university will do it or that the assessment centre does it, but just be aware, if you or your advocates or support workers don't do that, then the equipment order and the support will stall. And a copy of the funding body letter will be required for each provider. So your equipment supplier, your AT trainer, the non-medical helper support provider will all require a copy of that funding body letter. The letter will also include details of how to fix up taxi accounts if travel costs have been recommended, and how to claim back photocopying or printing costs. So what about the institutional support? Well, institutions should have a disability advisor that you can go to for support and guidance, and they may be able to liaise with your department on your behalf if your support needs aren't being met. They may have in-house non-medical helper provision, so they may have a specialist support professional for vision impaired students. They may have note takers, library support workers, examination workers, so scribes, readers, or your support may need to be provided by an external provider. They may provide lecture capture and lecture notes, examination arrangements, and they may provide the support that's no longer funded via the DSA. So as I say, the additional accommodation costs, the note takers, that type of support, but it is up to them. And they may provide the funding towards additional disability related accommodation costs. So what about COVID-19? I think that's why we're all here on Zoom rather than somewhere in person. But in terms of the assessment process, students should continue to apply for the DSA. Student Finance England and the other funding bodies are continuing to accept applications. They've moved on to home working, so everyone is still working from home and the applications are still being processed. The remote DSA needs assessments are being carried out, and as I said earlier, what's been recommended can be reviewed. The equipment delivery and setup can be carried out remotely. And the non-medical helper support can also be provided remotely, again via something like Zoom, Microsoft Teams, Skype. And we will return to face-to-face provision when it is safe to do so. And there are additional sources of advice and guidance on this slide that you may find useful. And finally, can I just say that the benefits of the DSA cannot be overemphasised. Please, please consider applying. You should also make sure that you inform the university of your support needs, because if they need to prepare materials in Braille or large print, that's very time consuming, and they need to know that you're coming, otherwise things are not likely to be in place for you getting to university. So I hope you found that useful, and I'm sure you will have fired off some questions and I will answer what I can. Thank you.
Thank you so much, Leslie. That was a really comprehensive overview of something that I think students don't often know. They find out a lot about the process, they go through the application process, and then it's, oh, what happens next, and confusion about, well, what is an assessment when I've already done my application process for DSA. So I hope people feel much more knowledgeable on what's going to happen next. I hope people aren't put off by the process. It sounds a lot, but I think it's so important to have those in-depth conversations to make sure that you have the right support in place for when you start university. And also it's so important to know what your responsibilities are. And it sounds like a lot of work, but I think it's so important then. That means that you have control over knowing when your equipment's going to be supplied and what's happening with your non-medical help. I am absolutely sure that we have lots of questions, and if we don't, I have a lot of questions, so I'm sure we can fill that space. So I'm going to hand over to Molly. Molly, what questions have we had?
Yes, don't worry, Tara, we have got some questions coming through, although please do keep them coming. Our first is from Tracy. She asks, what is HEI?
Sorry, acronyms are always very unhelpful. The higher education institution, so your university or college. Apologies.
All right. We've got a second question from PS. He asks, is the university responsible for financing screen sharing software?
I would have thought yes. Most universities have moved over to remote working, and teaching and learning are being delivered via remote means, and also the exams this year. Lots of universities have held remote exams. So yes, it would be the university's responsibility.
Thank you. We have a question here. What is the difference between a note taker and a specialist note taker, particularly in relation to VI students?
I'm going to cover it both for deaf and hard of hearing students and VI, if that's okay. For VI students, the standard note taking is where someone just take the notes and you either get a copy of the hard copy of the handwritten notes or typed notes. Specialist note taking for VI students is where there's some form of adaptation is required. So if the notes have to be structured differently, if they have to be reproduced in a larger print and or produced in Braille, then that would count as specialist note taking. Specialist note taking for deaf students would include things like speech to text reporting.
Okay, great. We have a message back from Tracy, actually. It's not necessarily a question. She just wanted to share her experience of going through the assessment process recently. And she just wanted to let everyone know that having done her application and her assessment via phone, she can definitely vouch for the whole process being very worth it, very helpful, and overall very pleasant and positive. So no one should be put off.
That's great to know. Thank you.
So Mary asks, how prescribed might mobility training be? Is it only for a campus or to shop for food or specific outings?
In terms of mobility training funded via the DSA, that would be for getting to and from the campus and around the campus. It wouldn't cover going to the shops or going into town. That would be a social services responsibility.
Okay.
So just to add to that, so what we would recommend is that you get in touch with your local authority as soon as possible, once you know that you're going to university, to ask for mobility support. They have a very long waiting list, so the earlier you get in, the more likely you are to get that support in place, and also have that conversation with the university about that additional support that you're going to need.
It can also vary from local authority to local authority. The local authority that's local to the university will sometimes pick up the tab for mobility training, but yeah, contact your own local authority first.
Okay, thank you. So our next question is, why do Apple products have to be argued for VI students when they are so widely recognised within the community as products that are more assistive and accessible?
It's not so much that they have to be argued more for VI students, just that the justification is actually frequently easier to make because they are so accessible. It's much more difficult to make a recommendation for an Apple Mac for a non-vision impaired student because there's not the same accessibility issues. So it's just that you do need to be aware that Apple Macs do need to be robustly argued. It's not enough to say my course uses an Apple Mac, therefore I need an Apple Mac, or I've only been using Apple Macs for the last 3 years. Neither of those justifications would get past Student Finance England. It really has to be a thorough exploration of the accessibility features of the Mac and how useful those would be to the students. And as long as we make that robust justification, we do usually find that they can be funded.
Okay. Mary points out that she's found that provider organisations often have a limited understanding of what hours are needed. So could you tell us a little bit about how non-medical hours are calculated?
Depends on the course. We do try as assessors to look at the requirements of the course. So if we know a course is heavily, for example, a veterinary course has a high amount of practical support, there's field trips, there's placements. So we look at the requirements of the course, and a typical university course will have 16 hours of contact time. But courses such as medicine, nursing may have different requirements. So we look at the likely requirements of the course. We also look at the student requirements, what additional support the individual student is likely to need, and then it's our best guess, really. I think it's fair to say that most assessors will slightly overestimate the support that's required so that a student doesn't run out of support. If a student is looking to run out of support, if they get back to the assessment centre, then we can put in a recommendation for additional support. But we would rather recommend slightly more than slightly less.
Okay. Another question's just popped in. Why is mobility training seen from the restricted view of simply a route or environment orientation when it's actually much wider learning than that?
The rationale for DSA funding is that it has to be funding that or support that the student requires because they're studying at university. And they would argue that if you require mobility training, you require it anyway, even if you're not at university. So the DSA has to be for disability related support that is related to your study. So that's why they would argue for that it's the learning of the routes around the university. We do often find that obviously as students move from one term to another, the placements might vary. You could be in different lecture theatres, places, locations that you've never been before. So the mobility training can be ongoing throughout the student's course.
Okay. One student has asked, student needs are often fluctuate within their course. For example, they might need more sighted guidance right at the start of their course, but not throughout. And for science courses, the early years are often very theory-based, and so the textbooks are needed more, whereas in the final year, more practical research is conducted. How can the DSA and the support that is provided be adjusted to those needs?
Okay, sort of two parts of that are to my answer. The first is that the assessor will try and work out what is needed for the entirety of the course. So if you're on a 4-year course that has a placement in the middle or a year abroad, then the assessor will try and take account of that within the report. So there should be recommendations that will take that into account. If your condition deteriorates, or if there are any unexpected elements to the course that the assessor wasn't made aware of at the assessment or prior to assessment, then you can go back to the assessor and ask for your needs to be reviewed. And the assessor can make additional recommendations for any of the elements of the allowance. The equipment allowance is a one amount at the moment, whereas the others are annual amounts, but you can still dip in and out of it throughout the course. If you develop a different condition, or if you have a 2 years or more gap in study, or if you move on to a postgraduate research course, you can approach Student Finance England and ask for what's called a review of your needs. And that is another formal assessment in effect. You would go back to the original assessment centre and have your needs reviewed. So there's sort of two sides to it. There's a formal review, but you can also just go back to your assessment centre if your needs have changed and ask for an update.
So does that include if your sight loss condition deteriorates further? So it's not an additional disability, but it's a change of your circumstances. Do you go straight back to the assessment centre as well? Straight
back to the assessment centre. That would not be counted as a review. Student Finance England would not. They don't usually authorise reviews just on a deterioration of condition, but just go back to the assessment centre and they will top up.
Mary has a follow-up question as well. Would that apply to students who switch subjects after starting one?
In terms of if you need additional support, if you move from English, say, to a science-based course, then obviously what was estimated at assessment is no longer going to meet your needs. So in that case, you would go back to the assessment centre and ask them to carry out or ask them to review your needs. You wouldn't be eligible for a formal review of needs. So you wouldn't have to go back to Student Finance England. It would just be a case of going back to the university and saying that your needs have changed. That's also the case if you've gone for the assessment in the summer holidays before you're due to start university and you subsequently change university or courses, then again, you can go back to the assessment centre.
Great. Here we have a question. Is there any extra help available for sourcing specific reference materials and books in an accessible format?
That would be a university's responsibility. Lots of universities have accessible format services or will buy in support. So you would need to approach your university because it's the university's responsibility to get you materials in an accessible format.
Sandra asks, can a student apply for DSA if they are not taking out a student loan?
Yes. You apply, the website address that I gave has links to there's two forms, two DSA forms. There's what's called a slim form and a full form. If you're only applying for, if you're an undergraduate, full-time undergraduate student, you would fill in the SLIM form, because Student Finance England will already have your student loan application on file and be able to get information from the university. If you're a part-time student or a postgraduate student, or you're not applying for the student loan, then you need to fill in the full form, and there is a section that needs to be filled out by your university. At the moment, because of COVID-19, the form usually has to be filled out by the university and have a formal university stamp on it. Because of COVID-19, Student Finance England have waived that, and they just need an email from the university stating that you have been offered or are studying on a course at that university.
Okay, we have a question about travel now. Could taxi travel be funded to and from London if a student lives outside? So I guess, is there any restrictions to perhaps mileage or location with the additional travel funding?
There can be some exceptions to travel funding if the Student Finance England feel that it's unreasonable. So if a student is living in London and decides that they're going to study in Nottingham, then they may view that as being excessive, although it has been funded before. So if you are living outside London and you're studying at an institution in London, then yes, the additional taxi travel can be funded. What Student Finance England will do is they will deduct the standard cost of, or the cost of standard transport costs. So standard public transport costs, they will deduct that, and the student is expected to pay that, and Student Finance England will pay the difference in cost. There is also a mileage allowance if a student needs to travel by car, but at the moment it's not terribly generous, and we do usually find that the public transport costs are actually more than would be funded via the mileage allowance.
Okay, we now have a question. Is readers and additional support available on placements?
Readers, they would not be, they're not funded, they're no longer funded via the DSA, via the Student Finance England DSA. So if a student needed a reader on placement, they would need to approach the placement provider or the university. There's quite a bit of toing and froing as to when it's a placement, whose responsibility is the support.
This question is, can you ask for an assessment at a preferred centre, or does it just have to be your local one?
Sorry, I didn't quite catch that, Molly. Could you repeat it?
Can you ask for an assessment at a preferred centre, or does it just have to be your most local one?
You can ask for an assessment at a preferred centre, and Student Finance England may be prepared to fund the travel costs. So if you're aware of a centre that has a good reputation, then you can go to that centre rather than the one that's nearest your home or your university.
Okay. Is there a checklist of what falls under the responsibility of universities and what is under DSA?
There's not so much a checklist. There are guidance notes, which are very, very wordy. They're about 70 or 80 pages long, and they are rather confusing. But largely speaking, the support that I mentioned in my slide, in my presentation, are the types of things that are expected to be funded via the university. As I say, the guidance notes have been written in such a way as it is the university's responsibility how they fund the support. There is, and this might be something that would be useful to know, there is what's called an exceptional case process. If you go to assessment and there's support that the assessor can't recommend, so say you require standard note taking or you need practical support in labs, that's not something the needs assessor can recommend, because it's how the university meets your needs is up to them. But if you feel that you need a standard note taker or you need practical lab support, you can request that from the university, and if they won't provide it, you can raise a case against them and take that to Student Finance England, and they may be prepared to fund the support in the interim while they argue the toss with the higher education institution, basically, who may then need to take on the support.
Thank you. How does PIP allowance affect a DSA allowance in relation to mobility, etc.?
Not too sure exactly what you mean in terms of that. The DSA is a grant, so it's not impacted by other benefits that a student's on. You would still be eligible for the DSA even if you were getting PIP. However, if you, for example, you get travel costs, or if you have a mobility car funded via PIP, then SFE would look at that if taxi travel was recommended, for example. So the DSA is for support that you need while you're at university, and your PIP would be for any additional support. If you needed personal support, for example, then that would be covered by PIP, or support that you need at home. I'm not sure that that fully answers your question, but...
Thank you. We have a question from Emmanuel saying, once I have completed the DSA form in full, do I also need to send evidence to Student Finance? And we also have a related question that came in through social media that said, if we have to have an assessment, why do we also need to provide medical evidence on top of that?
Can you repeat the first question, Molly?
So once I have completed the full DSA form, do I also need to send evidence to Student Finance?
You do. You can fill the form in online, and you should then be prompted to also send your evidence in. There is a separate Student Finance England email address for sending evidence in, and I'll make sure, if Tara hasn't got that, but I'll make sure I hand that over. So yes, you do need to send in the evidence. Student Finance England have a system whereby they don't chase for evidence straight away. So you think you've put in your application, you've filled in the form online, or you filled in a paper copy, you've sent it off. As far as you're concerned, that's it, application's in. As far as they're concerned, it's not. Until they have that medical evidence, they won't process it any further. They do chase eventually, but I think it's something like after a month or 2 months. So your application is what they would call pended in the interim. So yes, do send in a copy of the evidence. The reason you need to provide the evidence, both to Student Finance England and the Assessment Centre, is to establish your eligibility for the DSA. Only eligible students can apply. So they look at the course that you're doing. Is it an eligible course? Are you a UK citizen, or have you resided in the UK for 3 years or more? So there's various types of eligibility. So there's course eligibility, there's eligibility for the student loan and for the DSA itself in terms of residency, but there's also the disability eligibility, and they do need that evidence, otherwise you will not be made eligible for the DSA. The Assessment Centre also requires a copy of the same evidence, so that they will quote from that in the reports, and again, it's just providing proof to the Assessment Centre that you are actually eligible for the DSA.
Thank you. Francis asks, how would you change allocation of agency if you're not happy with the support that they are providing? For example, if you want to change your NMH provider.
You would go back to the Assessment Centre and request a change of provider. Student Finance England are usually fairly strict on the reasons that they will swap support, and it's usually because if the provider is not able to provide the nature of the support that you need, or that you're dissatisfied with the support. But if you approach the assessor and explain why you want to change support provider, then the assessor can make that recommendation. We have to provide 2 quotations for NMH providers to Student Finance England, and they will usually select the cheaper of the 2. Some universities have their own support services, and some students would prefer to stick with the in-house support. Others are quite happy to access external support. You should also be aware, though, that in some cases we've been asked to change support workers, and it's mainly been because a student hasn't been happy with the type of support they're getting, but it's because they're expecting the support worker to be a subject specialist and provide subject-specific support. And that's not what they're allowed to do. So in some cases, Student Finance England have stepped in and said, no provider will be able to provide that level of support, stick with your previous one. But yeah, if you're really not getting on well with your support worker, or the support worker service can't provide the support that you need, just get back to your needs assessor.
So just to clarify with that, because we have had contact from some students before that have struggled to get their equipment, they followed the process to get their equipment set up, but it's not arrived, or there's been problems, and any problems with the non-medical help provider. And it's to yourselves, it's to the assessment centre they go to, not to the university disability advisor, or do you advise that they raise the issue with both?
It can sometimes compound the issue if you're going to 2 different people, because the disability advisor may then take things up on your behalf, and the assessment centre would also be doing the same. What I would suggest a student does, if they're comfortable, if you've got issues with your equipment, go back to the equipment supplier. If you've got issues with your non-medical helper support, go back to the non-medical helper provider, but also keep the assessment centre in the loop. I can speak for lots of NNAC centres in that, where if we get complaints about an equipment supplier and we don't feel things are being resolved, then we'll stop recommending that supplier. So it is worth keeping the assessment centre in the loop, because often we can step in and say, look, you know, this student hasn't had their kit, they've had a bit of a raw deal, can you please sort it?
That's great, thank you.
Brilliant. Okay, I think we're only going to have time for maybe one more question, as we are already almost at 12. But thank you everyone who has sent in questions I haven't covered. We will make sure those are answered. I've taken note of all of them, so no one will be missed out or forgotten. But the last question I'm going to put to you is, how can students research what is available or might be available to them in order to prepare their list of requests that you recommended they put together? For example, I have only recently just gone blind, so have no idea what kind of support I need or what is available. Where do I start?
There's useful websites. I know that the Thomas Pocklington Trust on their website has links to providers of equipment and software for vision impaired students, so it's useful having a look at that. There's the annual Sight Village exhibition that is held in various places around the country. That's always worth a visit. It's nowhere near as big an exhibition as it used to be. It used to be the largest in Europe, I think, but there's still an absolute plethora of equipment and software and information for vision impaired students. Don't forget that your assessor should also be an expert in assistive technology. So it's quite all right to go along to assessment and say, I don't know what I need. You don't have to do the research yourself. If you want to, do it, but you don't have to, because that's the assessor's job. So you should be able to go to an assessment and discuss the nature of your vision impairment, the nature of the course, the issues you anticipate you'll experience, and the assessor should then be able to talk you through and demonstrate appropriate equipment and software.
Brilliant. There's one question I can just answer quickly from PS. Yes, this webinar is being recorded. It will be posted on the Thomas Pocklington website, and it will also be emailed out to everyone who's been registered for this event. We'll also let you know when all of the Q&As have been answered, and we'll put that up as a document for you all to read and reference if you need to in the future. Thanks. Back over to you, Tara.
Hi, that's brilliant. Thank you, Molly, and thank you so much, Leslie. I think that was really informative, and I'm sure everybody's got a lot to think about coming after this webinar. If after this webinar you think, oh, I really needed to know this, or what about that, please do email the Student Support Service. So we've got an email address, studentsupport@pocklington-trust.org.uk, and we'll send that out with all of the notes from this meeting. Do email over any questions, and we can cheekily add that to the list to send over to Leslie. But I'd like to thank you all for giving up an hour of your day today. I hope you all found this really, really useful. We'd really appreciate any feedback about the event. And thank you so much to Molly for going through all of those brilliant questions, and thank you again to you, Leslie, for your time, and we will be in touch. So we will draw this to an end, and we hope to see you all again for a future webinar. Okay, thank you everybody, goodbye, and thank you again, Leslie. Bye.